Our work in Tanzania has been twofold. Initially, we did analytical work that informed the country and investors on the market potential for health in this country. And this has now resulted in banks being more interested, recognizing that the health sector is actually bankable, but also for the health sector players themselves to recognize that for them to be more bankable, for them to grow their businesses, they need to change the models of business, increase their business acumen, and start running their clinics as better businesses as there is now. What have we seen in that? We've seen increased investment in the health sector coming in, both from IFC and from other equity funds into Tanzania. And not only that, we have seen better organization of the private sector, with AFTA as an example in attracting that concern and that interest. The second area that we've done is in doing a comprehensive private sector assessment. This is one of the 8 or so that we've done in the continent. And that report has both, number one, what is the size of the private sector? Number two, what are the characteristics of this private sector? Number three, what is the scope of reach, both in terms of the population that it serves and the geographical reach? And where are the gaps and how much more can it do? The report also comes up with very, very clear recommendations on how we can help grow a responsible private sector, but most important, focusing on increasing access to quality healthcare in Tanzania. Now, based on that, we have worked very, very closely with other development partners to go to the next level, which is the follow-up interventions. And you'll see already that the Germans through GIZ are very, very much engaged. USAID is pledging even more support. The Danish through Danida are working very, very closely here, and everybody therefore is joining hands to make sure that we have a sustainable program in Tanzania. Our strategic approach to our work in Africa, starting from where we started, where there was nothing, we had no roadmap, we created our own roadmap. And that roadmap was multi-step roadmap. The first step in it, in every country that we are going into, is to do an analytical work that informs the common platform for discussions. Because often people are not confident that there is actually a private sector in an African country, and that it is responsible and that it wants to engage. So that data usually is the most convincing piece that both the government, development partners, and even the private sector stakeholders themselves have. So step one is the analytical work. Step two is the actual engagement on specific areas that are recommended from the analytical work. The areas for engagement, policy reforms, regulatory reforms, and financial reforms. That is the second area. And the third area is going into deep dive into the actual access to finance issues. This is where things like the PPP transactions, if they are found to be viable, come in. This is where the establishment of financing instruments come in. And this is where, too, in this third phase, we start handling some of the heavy lifting that is required in this area. For example, in several countries, Nigeria, Kenya, and Ghana, we have gone into social health insurance. And why is that important? Because for the private sector, when you have a sizable proportion of the population that is insured and can pay for services, then you can start thinking of expanding and investing more in your business. Yeah, 3-day conference here that brings together not just the Tanzanians but by other East African countries, high-level participation, I think is testimony of the kind of effect that our work has had in the region. Number one, the profile of the private sector in health has gone up tremendously. So in every country that we've been to and where we are, higher profile, better dialogue, establishment within the ministries of private sector department to be able to dialogue with the private sector. On the private sector side, we have seen the formation of umbrella bodies that give the private sector for the first time a single voice. Rather than being fragmented, they have voices. So in Kenya, we have the Private Healthcare Federation, similar in Uganda, similar here in Tanzania, and similar in Rwanda. And these ones are now coming together at the regional level too. So they are influencing then decisions at the regional level and in terms of the broader market and bringing down the barriers that make it possible for medical business to cross the borders. So tremendous impact that we are seeing. But that's not enough. We are also seeing actual investment. And there's already more than 10 companies that have received investment from IFC in this sub-region alone. We are seeing other investors coming on board. In Uganda recently, the first Japanese investment in medical products in Africa through a company called HiA coming in to be manufacturing in East Africa. We are seeing in Kenya, I've just seen the latest, that there is a European firm that is coming in with 4 billion euros to invest on public-private partnership arrangement for cancer treatment and renal treatment. Unprecedented, the kind of monies that are coming in. We are seeing training being undertaken by the private sector. South Sudan, the first group of nurse anesthetists ever for South Sudan, is being done on a public-private basis, again as an impact and a result of what we are doing. So what we are seeing here is better production of more human resources with the private sector participation, access to services and new services too as a result of that, production of goods and medicines and so on in the region by the private sector all coming in. So there is a big contribution that is already being sensed.